briefing today. The doctors today are Dr. Albert Au, Principal Medical and Health Officer of the CHP, and Dr. Larry Lee, Chief Manager of the Hospital Authority. First, Dr. Au will tell us about the new cases. Good morning, good afternoon, members of the public and media friends. Now I will tell you about the new situation yesterday on the 14th of June. Yesterday, there were altogether 971 locally infected cases, including 477 PCR positive cases, and also 494 cases reported via RIT and confirmed by our PCR test. And also we had 76 imported cases yesterday. So far in the fifth wave, we have 209,177 cases. Among the imported cases yesterday, 35 were caught as the temporary specimen collection center in the airport. 31 were found during hotel quarantine. The remaining 10 were tested positive as the community testing center after hotel quarantine on the 7th day. These samples will be sent to the Public Services Laboratory for genome sequencing to see whether they were locally infected. For deaths, yesterday there was one new death. So far in the fifth wave, we have recorded 9,179 deaths. For care homes, there were 4 care homes with reported cases yesterday, including 2 residential care homes for the elderly and 2 care homes for people with disability, involving 4 staff members and 10 residents. The first one is the long-term care home for people with disability in Sham Shui Po. One carer had an onset on the 12th and last work on the 11th. 3 residents are classified as close contacts. The second is Yan Chai Hospital, Gok Yuk Zhang Fu Yan care home in Kwai Ching. 2 staff members who work on the same floor have tested positive. 66 residents are classified as close contacts who will be sent to quarantine. The third one is Kei Hong Hui Ho Sin Hang Fu Yan residential care home for elderly people in the Southern District. 1 carer has tested positive. 5 residents are classified as close contacts. The last one is Christian Family Service Center, Shangzhen Center for people with disability in Kwun Tong. That is located in Kwun Tong Rehabilitation Center, 6th floor. 10 cases were reported from the center. All are residents. They have been sent to hospitals or isolation center. No staff member was infected. The remaining 30 residents in the care home will be sent to the AWE for quarantine. For schools, since yesterday's afternoon, we have received 147 reports involving 135 students and 12 teaching staff, involving 127 schools. Among these schools, in the past 5 days, for school with 2 or more cases, there are 48. We have no outbreak in classes which require suspension of schools. Among the new reports today, 1 case involved a 17-year-old Form 5 female student in Puijing Secondary School. On the 13th of June, she was tested positive on RAT. We took her sample for a confirmation test. The genome sequencing confirmed that it is BA 2.1. The onset was the 16th. On the 12th. On the 10th of June, she attended a gathering with 60 classmates and 5 teachers at Sek Mei Hin at Horman Tin Taiping Road. According to our investigation in the gathering, there were also 5 other students who were tested positive 3 sat at the same table with the girl, and the other 2 students were seated at 2 other tables. So far, 6 students were infected from the gathering. All of them studied in different classes in Puijing Secondary School. Because they may be BA2, BA 2.1, 2.1 carriers, all classmates at the tables, around 10 of them were required to undergo home quarantine. For other classmates in the gathering, we advised them to stay home until the 19th of June. For genome sequencing, yesterday we have found 23 new suspected BA 2.1, 2.1 cases, including cases with epidemiological links with these cases. Among the 23 cases, 1 was imported from Singapore. The remaining 22 cases were all locally infected. Among them, 5 we could not find the source of 5 cases involving 2 family members, altogether 7 cases. They live in Sham Shui Po, Tong Dak building, and Prince Edward, and Whampoa Garden, phase 10, block 3. That is the address of the secondary school student just now. 2 families lived at Hin King Estate, Hin Yang House, and the remaining 1 untraceable case lives at block 33 at Hang Fa Chun. The remaining cases are all epidemiological linked, including 1 case living in a Kowa building at Lockhart Road, 1 in a war fight court in Warming Estate. 4 cases are involved in Lohas Park. They are the family members. 5 cases involved construction site workers working at Site B of the Lam Tin Changguan Tunnel. That is Transport Infrastructure Contractor Company Limited. They work as the administrative building at the site. 2 previous untraceable cases also work at the site. They live in Tuen Mun, the Oasis, and the other one lives at Kwai Chung. For the Oasis case, the 4 family members are also tested positive. For the suspected BA.4 and 0.5 cases, we had 3 new cases, all imported yesterday. And some updates about the previous clusters. First, about Red City and the bar. We found 1 more case today involving a patron. So far, the cluster has seen 23 cases, all are patrons. The infection rate is about 28%. And for FLM, 5 more cases are found today. So far, from the cluster, we have 33 cases involving 30 patrons and 3 staff members. The infection rate is about 25%. Thank you. Now, Dr. Lee, please update us on the HA situation. Good afternoon. At present, we have 412 confirmed patients in hospitals with 73 new cases. For those who, among patients in isolation facilities, 126 are in isolation wards, 13 in Tier 2 wards, 53 in the North Lantau Infection Control Center. 52 are new patients. Yesterday, we reported 1 critical patient with no vaccination record, and we have no new critical or serious cases. Among inpatients, we have 16 critical, 6 serious patients, and 6 critical patients are in ICU. We also reported an 83 year-old female patient who passed away yesterday. She was not a resident at care homes, and she had no vaccination record. She had a heart problem, and she was sent to the A&ED of Caritas Hospital on the 7th of June. She was unlucid. She had a broken femur, and according to scanning, she had a Duma hammerhead on the left spring. And the hammerhead got worse, and on the 14th of June's night, she passed away. We believe her passing away has no direct relation with COVID. Yesterday, 48 patients have recovered, including 43 discharged. So far, 51,011 patients have recovered, with 50,620 patients discharged. Since the early 2020, 63,391 patients have recovered, including 63,002 patients discharged. One patient was found to be positive on admission. 2 patients in the same ward are classified as close contacts. For staff, we have 23,809 HA staff infected, with 23,716 staff members having returned to their positions. Thank you.
提問時間，咁請大家。
Now it's time for questions. Please identify the organizations you represent. Doctors HK01. About the announced numbers, why do you separate the local cases and the imported cases? And in connection with the tightened measures for bars and pubs, it was announced that there will be relaxation regarding the speakers wearing of face masks. Now you relax the face mask mandate on the speakers. Why is that? And the RAT test requirement for bars and pubs, is the CHP taking a step at a time without any long-term strategy against the pandemic? Thank you for your question. On the first question about the numbers, starting from yesterday, we have enhanced the presentation of the figures. Previously, we announced a lot of breakdowns, and these breakdowns may not be easily comprehensible by the members of the public for them to understand the trend of the pandemic. Starting from yesterday, we have separated the imported cases and the local cases into 2 different numbers. For local cases, we also separate them into PCR numbers and also the RAT verified by PCR. Now, these numbers are of concern to the members of the public. These 2 numbers are reflecting different situations. Now, for the imported cases, it all depends on the immigration or the inbound policy. If there are more people coming in, the number will go up. And this doesn't have anything to do with the transmission in the community. This has to do with the inbound policy and the external situation. And we are reflecting these with one single number. More importantly, the local infections are more important numbers, because that will reflect the daily caseload that we registered every day. So this would enable the members of the public to understand how many cases we chalked up every day. So it all depends, of course, on the willingness of the people to undergo tests and the chains of transmission in the community and the volume of testing. But this number will certainly enable us to get to grips with the community situation. Of course, we will have regard to the hospitalization, the death numbers, and the ICU numbers, and so on. The second question is about the tightening up of the measures for bars. As you can see, over the past fortnight, we've seen an increasing trend in the number of infections, taking us close to 1,000. It shows that there is increasing transmissions in the community. For high-risk premises like bars, people are taking off their face masks, and there is unmasked interaction among the patrons, and there is a higher risk of an outbreak in these kind of premises. So, in order to curb the rising trend, we believe that an RAT test would certainly enable us to pick up these cases that people may be infected without realizing it, and we will try to pick them up. Lady at the back, please. RTHK. About the reporting presentation, now if you include the imported cases number is more than 1,000, are you trying to play down the number? Will people get the impression that the numbers are not as high as they are? And also the preaching college, what kind of gathering was that? Thank you for your question. For the first question, the idea of the new presentation is to present two sets of figures. The one is an imported number, the other one is the local number. Now, taken together, we know the total number of infections, but we are reflecting the local infection in one number. The other one is a reflection of the imported cases, which will be susceptible to many different factors. And if we take them together, the number may sound quite a lot, but we have to look at the proportion. I'm sure that the members of the public would like to understand how many cases are there in Hong Kong every day and how many there are for imported numbers. So that will present the situation clearly to the public. The second question about the preaching gathering. This is a dinner gathering with about 60 people involved. These are the athletic team and the teachers, and they had a gathering on the 10th of June, and cases began to emerge afterwards. We believe that there might have been some transmission going on during the dinner gathering because we picked up cases from the same table. Now, when they were having meal without mask on, there was a risk of infection. And also they had some contacts during the athletic training, although they had their mask on. For those who have taken part in this dinner gathering, we advise the school to make them undergo the test. And there is a case that has certified to be a BA.2.12.1. We will be doing the genome sequencing to see whether there are any similarities there. Lady at the back in white, please. Doctors Now TV. Now for the preaching cluster, the students were having dinner together. What is the ventilation situation like? Do you have any more information about this? And also the dance cluster from yesterday. What is the ventilation like on the premises, and what kind of dance did they engage in? There are some bar operators who said that the new requirement is really making life difficult for the bars. How did you actually come up with these guidelines? Right, for the preaching gathering, this preaching cluster, we are still conducting investigation. We haven't quite got any information about the ventilation. Now for the Funky Dance Center on June 7th nighttime, there were some trainees who were there on the 17th floor having lessons there. There was an instructor who tested positive for COVID, and thereafter the trainees began to be infected on about 10th or 11th of November of June, and on the 12 and 13 that we began to receive these cases. So there was a cluster. We have already subject these under CTN. There are 7 cases at the moment, 1 instructor and 6 trainees. We understand that most of the other trainees have already undergone the tests.
In terms of the environment, during the activity that night, that was a funky dance. The students were standing some distance apart. They were all facing a mirror and had their backs against each other. However, during the break, around 5 minutes, the students took off their mask and drank water. It might be the case that the virus carrier got others infected during the break. The gentleman over there.
2 questions from the South China Morning Post. So we would like to follow up on the new arrangement about the reported cases. So why didn't the authorities make it clear yesterday about the new arrangement? And can you explain why the sudden change done yesterday? And we would also like to know if these new practice do align with practice from other countries, and also the purpose of the new changes, because right now it seems that the authorities have it's in their interest to lower the case number right before the July 1st, when the state leaders are coming to Hong Kong. And we would also like to follow up on how can pubs and nightclubs verify those RAT tests. So if a patron gives a false or fake result and is later caught by the authorities, so will those premises have the liability for the wrongdoing of that patron? And also, we'd like to follow up on the relaxation of mask wearing during talks and seminars, because right now speakers can take off their masks during the speech, but at the same time there is a more stringent rule put upon pubs and nightclubs. So why is there such a difference? Thank you.
Thank you for your question. For the first question on the new arrangement for announcing the daily number of confirmed cases, this is to enhance the risk communications. We want to, previously we have we give a single figure which includes the imported cases and also the locally acquired cases. But these figures, there are 2 components. First is the local cases, and second is the imported cases. They are quite different in the interpretation of these 2 sets of figures. For the locally acquired cases, it shows the degree or the level of transmission in the community, which in the local community, which is important to assess the local epidemic situation. And secondly, for the imported cases, this is quite different. The number of imported cases we encounter every day, it depends on the policies for inbound travelers and also the epidemic situations in overseas countries, which is quite or not too related to the local epidemic situation. So we want the public to understand we separate these 2 sets of figures so that the public can more understand how the cases are distributed among these 2 categories. For the second question on pubs, I think the FEHD will issue guidelines and also assist the trade to check on the method to check the RAT testing for the customers. And this is one of the risk management measures to decrease the risk of transmission or the risk of outbreaks occurring in these very high-risk settings where there might be, or there are always mask-off moments during the activities inside these venues. For the last questions on the relaxation of wearing masks during talks and seminar, I think that this sentence is quite different from the bars or pubs where there is quite a lot of mixings between the customers. For talks and seminars, always the attendees they will wear masks, but however for the speaker or the presenter, there is quite a distance between the audience and also the speaker. So the risk is much lower than the bars and the pubs.
下一題，嗰邊個位？
Next question, please. Good afternoon, doctors. I'm from Orange News. About the trend today, we have a 4-digit number. So how would you assess the trend? Will we see exponential growth in the near future? Now we are at a 4-digit level, but we don't have a lot of serious cases. So how would you comment on the rising trends risk on the community? We are having more imported cases every day. So would you announce the places where patients have stayed before coming to Hong Kong so that we will know where they come from? Now about the 上增加 residential care home for people with disability. So what was the transmission route? Was it airborne transmission or via shared facilities? For the patients, did they stay in the same area, and when was the earliest onset date? Thank you for your questions. First, about the trend of the epidemic. In the past 2 weeks, through different indicators, we saw a gradual rising trend. From 200 to 300 cases each day in May. Now we are looking at some 1,000 cases per day. It shows more rapid transmission in the community. That is within our expectation. In the end of May, there was a new round of relaxation of distancing measures. More people went out and visited restaurants and high-risk settings. Through epidemiological investigation, we have identified quite a number of outbreaks in bars and restaurants. That is within our expectation. However, we do not see evidence at this stage that there is an exponential increase of cases. Since early June, we saw a gradual rise, unlike which we have seen in late February and early March, when the number doubled or tripled every other day. We saw more infection in the community. However, the vaccination rate compared with before the 5th wave is much higher. We do have a certain level of herd immunity in the community, and many people were infected in the 5th wave and are now immune. Yes, we have more cases, but the number of hospitalization, serious cases or deaths remain at a stable level. Still, I urge members of the public, if you have not been vaccinated or if you have not completed vaccination, please do so quickly. The immunity level after infection would decrease in time and the risk would increase. For imported cases, we are monitoring the origin places of the travelers each day. It's just that we haven't made an announcement because there are quite a number of cases. We will continue monitoring the situation. Most of the cases are from several major countries, and it is proportional to the number of visitors coming from a certain country. They are mainly European countries or the US. We don't have a certain country with a lot of cases.
咁呢個
The third question about the Shenzhen house outbreak. We believe that this is a rather large outbreak. On June 12th, some of them tested positive, and on 13th and 14th, there were residents who came down with COVID, and some of the cases stay in the same room. And in this Shenzhen house, they have a mixed activities. There is some mixing in mask-off activities. We believe that in these kind of activities, they caused an outbreak in the Shenzhen house. So as precaution for those who haven't been infected, will be sent to the AWE for quarantine. As to the source of infection, there are 24 staff members. All of them have undergone PCR tests, and they all tested negative. So the source of infection could have come from outside the institution, and someone might have been infected and brought the virus into the institution. They were working in this workshop. We are still investigating this. Gentleman in stripes. AM 7:30. About the new isolation arrangement. Now, for people who have to share the use of toilet and rooms, there will be quarantine in designated facilities. And what is the capacity of these facilities right now? And I mean, is this really the case that if they share the use of the facilities, they have to be sent to designated quarantine? I mean, is the preaching cluster a case of BA 2.12.1? Did they use the entire hall, or did they? Was there any petitioning there in the eatery? Is the CHP of the view that the caseload is well over 1,000? You have suppressed the number with the separated presentation. First, about the isolation facilities. Since March, we have adopted this multi-tiered triage system to ascertain who can be isolated at home and who will be sent to the isolation facilities. Through the online questionnaires, we gather all the information. Now, for PCR test, we would interview the people on the basis of telephone interview. We look at the risk level and the home setting. This has always been what we did. If people are not suited to home isolation, if they pose certain risks to the household members, like they don't have a separate room for isolation, or if they have to share the use of facilities like toilet, and there is a likelihood of transmission. And where possible, we will arrange for them to go to isolation facilities. The SFH made the announcement yesterday. We have enhanced the arrangement. We gather all this information, and we would have regard to the information furnished to us. We would also have regard to the residential address to see whether there is a chance of them sharing the use of toilets. Now, there is a question like, do you have a separate toilet? And can you disinfect the toilet after use? If there is no separate toilet, the risk is pretty high, although they can disinfect after use. Now, for those who don't have a separate toilet, they will be arranged to go to the isolation facilities to avoid any transmission of the virus. For close contacts, they don't have to fill out any online questionnaire, but in our epidemiological investigation, if we find that there are household members, we would also use the same yardstick to see whether they are suited for home quarantine. If they are not suited, then we would arrange for them to go to the quarantine facilities. Now, regarding the student and the BA.2, 0.12.1, this is the first time you've seen this. There is only one case that has been confirmed to be suffering from BA.2, 0.12.1. For the other 5 students, they were part of the dinner. There may be some epidemiological link. Now, you probably remember that in the McDonald cluster and the DSC International School, there is an outbreak there, and that's also BA.2, 0.12.1 as well. The last question is about the numbers. As we said, we're trying to enhance the presentation of the figures. We're trying to separate the local figures and the imported figures so that people would have a better idea what the COVID situation is like, or whether we have more imported cases or more local cases, and also the trend, the respective trend for the 2 numbers. And that's why we're separating these 2 numbers for a clearer picture, and this is an enhancement measure. Speaker not speaking through. We have to find out about it. There are about 70 or so people from that school. As to whether there are any other patrons, we still have to conduct further investigation. Gentleman at the back. Dr. Ming Pao Daily, BA.2, 0.12.1, there are 22 local cases. I don't think they add up. You mentioned the Longbourn Oasis. There are 4 positive cases. Are they part of the 22 today? Tower 10, Longbourn Oasis, that has to be subject to RTDs related to this. And for the Kwun Tong RCHD, there was an outbreak before. Now, for these 10 cases, were they ever infected before? And what is the genome situation like? Would there be an outbreak like this? The Pui-Ching students suffering from the new subvariant, are you advising the classes to be suspended? And what about the teachers? Do they have to be suspended as well? My final question is about the criteria for isolation. Now, in Hong Kong, most people have only one single toilet at home. Now, with these new criteria, how many people are likely to be sent to the quarantine center? People are worried about being sent to these centers, and they may not be declaring the infection. You said that you will be applying the same standard for quarantinees. Will you also look at the toilet facilities as well? Right. Thank you for your question about the outbreak in the care homes. In recent months, there was a large outbreak in an RCHD. We can see that in the community there are more and more cases, and there is a likelihood, there is a risk that these cases might enter the care homes. So we are requiring all the staff members and the residents of the care homes to undergo rapid antigen tests every single day, even if there are cases making their way into the homes. We will still be able to remove the infected person from the care home. And for the close contacts who have been exposed to the risk, they can be quarantined accordingly. And that way, we can avoid any massive outbreaks. For the RCHDs, earlier, we noticed that if an outbreak were to occur, it can occur pretty rapidly and pretty massively. because these residents do not have a self-care ability. They may not be wearing the face mask properly, and that would cause an outbreak.
即係
As a result, vaccination is the most crucial thing. In this outbreak, we have patients who were not vaccinated. The cases would be more serious and required hospitalization. For residents who were vaccinated, their situation would be more mild. Second question on the Puiching Middle School. All the patients are members of the school's track team. They attended the dinner gathering on the 10th of June. They study in different classes, and after testing positive, they stopped coming back to school. There is no evidence of in-class transmission, which requires suspension of classes. So for all students, they need to undergo RAT before going back to school every day. If we see outbreak in certain classes, we may ask the school to stop the classes. So we are seeing a rising trend of the epidemic. We certainly don't want to see any more transmission in the community. So the major risk of transmission is among family members. For previous cases, if someone in the family got infected, more likely than not, the family members would also come down with the illness. So we would assess the situation at home. When it is not suitable for the patient to undergo isolation at home, we would arrange them to go into isolation facilities. At present, we have ample capacity to take in these patients to prevent further spreading the virus to family members and the community. Sorry, the speaker is not coming through the mic. May I clarify? We have 23 suspected cases or cases with epidemiological links with the cases, 1 imported and 22 locally infected cases. Among the locally infected cases, 5 were untraceable, and 2 cases are the family members of the untraceable cases, so altogether 7. The remaining 15 cases are cases with epidemiological links with previous cases, including 5 from the tunnel construction site. 4 are the family members of another tunnel worker, so altogether 9 cases. 4 cases are the family members of a previous case. The remaining 2 cases are from buildings with infection. Next question, the lady over there. Good afternoon, doctors. I'm from iCable. The CHP said just now that guidelines would be issued to pubs on RAT record checking. You said it is a risk management measure. So what if pubs providing RAT kits for customers to test on site? Would it increase the risk? Should the bars set aside an area for customers to do the test on site? In the past week, we saw an increasing trend. Yesterday, Professor Chen said it was a rebound. So how would you define a rebound, or are we already in the 6th wave? First, about the RAT before entering pubs and bars. Yesterday, the Secretary for Food and Health has announced that in the next 2 weeks, for customers entering these high-risk environments, they need to do a RAT. If they are found to be positive, and they shouldn't enter the premises. So this is also a risk management measure. We encourage the public to comply with our requirements. Do the test at home or at a private setting. If you are tested positive, you should declare the result and stay at home and wait for our isolation order and further investigation. I believe the law enforcement agencies will communicate with the industry to facilitate the measure. On the trend of the epidemic, there is an obvious trend of rebound. Since late March, the number has been dropping. Still, the fifth wave never ended. The lowest number we had were 200 to 300 per day. So the fifth wave hasn't ended yet. And with relaxation of social distancing measures and people moving toward normalcy, we see more transmission in the community, and this is a rebound. We will continue to monitor the trend. We consider that this is a rebound of the fifth wave. Of course, more observation is needed. Last question, please. Hi, I'm from Hong Kong Economic Times. If a patient does not have an independent toilet at home and has to be sent to an isolation center, when did this arrangement start? Is it yesterday? If that is so, how many people have to be sent to isolation center? Was it that the patient told you they don't have independent toilets at home, or have you carry out an investigation? Now, about the gourmet hot pot at from the Pui Ching Pui Q cluster, is there an outbreak? Now, the staff member last went to work on the 19th. However, she was tested positive on the 12th. So why was that? For the Lam Tin Jungle Tunnel, did the 5 workers aid together, and also would you suspend work on the site? Thank you for your questions. First, on isolation arrangements. We are following the policy of the CHP to triage the cases. We would assess the home environment of the patient to see whether it is suitable for isolation, mainly whether there is an independent room and an independent toilet. So the patients would be asked whether there is an independent toilet and whether disinfection can be performed immediately. Depending on the answer of the patient, we would make relevant arrangements. The purpose is to enhance the arrangement, risk management of our patients without an independent toilet, because they would have a higher risk. For these cases, we do want to send these cases to isolation facilities to minimize the risk of family infection. So that's an enhanced measure on home assessments, which began yesterday. Second, for the gourmet hot pot or Sek Mei Hin, the vaccine pass requirement was in place. On the night concern whether there were only those school students or if there were other customers, we are still investigating, and we will check the Leap Home Safe record. We have talked with the school, and all teaching staff and students attending the gathering would be required to undergo tests. For the construction site cluster, all the patients work at area B in this site. There are some 100 workers working at the site in that area. They have interaction and also a daily briefing before work. People from different shifts would be gathered together. All 7 workers came from the same group, and they would work together. The work is to monitor the traffic situation on Route 8 from a monitoring room. There would be 4 to 6 workers working together in that room, and they would eat at the canteen and share the same changing room. We believe that it is during work, when they have taken their mask off, that infection occurred. We have required the company to require all remaining workers working at Site B, Area B, to do a PCR test. That's the end of the media briefing. Thank you. Sorry, the speaker is not speaking through the mic. Sorry, the speaker is not speaking through the mic.
As part, I understand this is a public health measure based on public health grounds.
記者會結束，多謝大家。
This brings us to the end of the press conference. Thank you all very much.